Hello everybody. In this video we will continue to speak about communication techniques. And if you are interested why there is a pair dancing in the picture, the reason is that the right communication is similar to a dance. You must always pay attention to your partner, and if you stand too far, so the communication is too distant, too cold. However, if you go too closely, you can tread on his foot. So there is always some risk and you must be very careful. If you like to see the previous video about the communication techniques, please click on the link below the video. So, in this and in the next video, we will explain following 5 techniques: reflections, affirmations, open questions, summaries, and offering information. And reflections are the most important, most useful techniques, and we will speak about them in the rest of this video. Reflections mean that you repeat the content of patient's last sentence using your own words. However, you can reflect also other things like his behavior, his emotions, probably. So the basic difference is differentiation is between simple reflections where you just repeat what the patient has said and that's all, and complex reflections, this the rest of the reflections. And we can, for example, reflect underlying emotions we guess the patient has. For example, when I told no to him, I felt badly. So you can guess and react, you felt guilty. This trembling of fingers makes me nervous. And you can suppose there is maybe some mimulus theme, so you can continue. You are worried that it might signal some serious problem. Sometimes they make me so angry that I must leave. You can interpret or reflect as you have a fear of losing self-control. So maybe it might be cherry plum if he accepts it or doesn't react and continue in his talk. Otherwise, he will tell, no, it's not a fear of losing self-control. I'm just irritated and want to get rid of them to leave. We can also use reflections to explore so-called incongruity. Incongruity means some discrepancies, some disharmony, for example, between what the patient says and what you can see or hear. For example, the patient says you, oh, thank you, I'm fine. However, you hear that his voice is trembling. So you can react, for example, you say that you are fine and your voice trembles. Or he may tell you, and this made him really furious. Ha! So there is a discrepancy between what he tells and that he laughs. So you can react, you speak about serious things and you laugh. You can also use reflections to explore incongruity between patient's words and deeds. For example, you are angry at him and you are always ready to help him. A special situation is when the patient hesitates between 2 options, for example, and it's expressed by a sentence where he uses a word but, and it seems for a while that he is inclined to one option and then he is inclined to another option. And the problem is that he can spend a lot of time, he can waste time and energy, but he will move nowhere. And instead of reflecting one part or another one, you can use one so-called two-sided or double-sided reflection to reflect his ambivalence, his hesitating. So if the patient says you, I should go to the exam, but I have a fear of failure, and in fact he has a tendency to postpone exams, and you know that this postponing isn't good for him. You can react, you have a fear of failure, and you feel you should go to the exam. Another example of double-sided reflection is during follow-up, for example, the headache seemed a little bit better for a while, but last week it was terrible. Again, seemed better, worse, and you can react last week, the headache was intense, and there were also moments when it seemed better. Or I know I should stop smoking, but I have a weak will. You can react on one hand, your will isn't too strong. On the other hand, you know smoking is harmful to you. And this double-sided reflection prefers one of these options. So you put this option that you consider positive for the patient to the last position. And another rule is do not use but, because but somehow devaluates the first part of the sentence. And it provokes the patient to react, to defend the first part. So instead of that, use either and conjunction, or you can tell on one hand and on the other hand. You can also use amplified reflections. Amplified reflections are used when the patient feels he is in a dead end, he has no option. For example, I have so much work and nobody helps me. You can explain to him that he has many options and suggest, and he will refuse it one after another, so it will lead nowhere. So you can use amplified reflections. You have to overstretch yourself, and there is absolutely no way how to find some relief. So you still increase it, so you magnify this impossibility. Or I'm completely paralyzed. You can react, you cannot do the slightest move. Or this situation is hopeless. There is absolutely no chance to change it. And the reason, the sense of the amplified reflections is that it can provoke the patient to react, well, okay, there is at least some little chance, but, or yes, I can move, I can do at least something. So it can open the conversation, you can open a new theme, and you can discuss how this option can be used. You can also use weakened reflections, and weakened reflections are used when the emotions are too strong, and it is difficult to take case when the patient is too angry, for example, or too hopeless, too desperate. So the patient, for example, bursts with anger, beats with a fist, and is very angry, and you can react, his behavior has made you angry. And you speak calmly, and it will calm the patient down, and you can communicate on a more rational level. Or it is so desperate, and you can react, your hope has been shattered. So it's not so complete desperation, but your hope, it's a problem with your hope. You can also direct the conversation. For example, I have to take children to school to go to work, then to take the children from school to prepare dinner, and so on and so on. And I feel so tired that I go to sleep. And you can direct the conversation to whether somebody helps her or not. For example, you have a lot of duties and nobody helps you. Or this situation is annoying, it is the same over and over, and you can guide him to a change. This situation is annoying and it is the time to change it. You can also use metaphors. Metaphors are great because they express in a few words a whole situation, and they carry emotions. For example, when it's clear when somebody feels like a hamster in the wheel, or your thoughts hum like a beehive, or you hit the bull's eye. And there are also some problems. You can make a mistake when doing reflections. It's not so simple. For example, some people use an intonation of a question. So when I told no to him, I felt badly. So you can, the correct reflection would be, you felt guilty. However, some people ask, you felt guilty. So it's another question. It doesn't work like reflection. Or you may sound ironic, sarcastic, or joking, because in many, especially for example, amplifying reflections, it may sound like a joke. So you must keep poker face. So when somebody tells you, I have no option how to change it, and you tell you have absolutely no chance, no way to change it. And if you stay serious, it's okay. But if you start to smile, so it means, or the patient may feel that you are joking, so it will disrupt the relationship. Or some people just stay on a superficial level. They repeat what the patient has said, and it may sound mechanical and it doesn't help much. And finally, some people use ballast words like you would like to say, it sounds like you, or it seems to me like, and it may impress to the patient like you are using some psychological tricks, and it also disrupts the communication. And what are the advantages of the reflections? So the most important reflections are not roadblocks. So the patient's speech is fluent. If you are correct, he just continues or tells just or if you are not correct, he corrects it. They also support spontaneous speech. The patient can continue how he wishes. And they give a feedback to your patient that you are listening to him and that you are understanding him. And it also gives a feedback to you that you can verify whether you have understood correctly. And also you can slightly direct your patient if necessary. So still once, there are simple reflections, exploring emotions. You can explore also some incongruity between what you hear and see, or between behavior and words. You can use amplified reflections to find a new way from a seemingly dead end. Weakened reflections to reduce the emotional charge. Two-sided reflection when there is some ambivalence, some hesitation. You can also direct or guide the patient during the consultation, and you can use metaphors that describe the problem better than simple words. Thank you for watching this video. I hope you have enjoyed it. And in the next video we will continue about communication techniques part 3.